Okay, so let's look at this. And you might have seen this chart in some physicians' offices or medical offices, and you might be thinking, what is this? And you might be like, oh, this looks like a really ugly bodysuit or leggings. But what we have here is something called dermatomes. And a lot of times when you see this picture in the Martini textbook, a lot of students are confused because like, wait, why is it kind of like swirling this way and that? Yeah, so what we have here is that it shows anterior and posterior. So it's actually showing two halves, but now they just flipped it around. So you're not seeing the whole front or the whole back. It's only half of the front and half of the back. But notice that it's kind of color coded. I mean, it's very gaudy, but notice if you zoom this up or blow this up right here, what do you see is that these correspond to the cervical, thoracic, lumbar, and sacral. Hey, what did we just cover? Those regions are also spinal cord regions and also vertebral regions, right? But now we're talking about spinal nerves, right? So let's look at the gross anatomy of the spinal cord. Again, there are four major regions: cervical, thoracic, and lumbar, and sacral. And this is very important because this is what determines the patterns, or this is related to those patterns we saw in the previous slide. Okay, so what we see here are dermatomes, and again, it's very confusing at first. So what I'm going to do is like kind of change this a bit so you see just the front right now. And now it starts to make a little more sense. So what is a dermatome? So what a dermatome is basically it's a area of the skin or the outer surface of the skin and body that is goes to that part of the spinal nerve. So everything in this region right here goes to the T1 spinal nerve on each side. And then here is like this one goes to the C5 spinal nerve, this one goes to the L1 spinal nerve. So all of these are corresponding, and this is where, so basically all these regions, whichever letter and number it has, it goes to that corresponding spinal nerve that leads to the spinal cord. And what we have here is the backside. So in this backside, we see that, okay, it's not quite the same as the front and the anterior. So you notice like some things you might see, okay, you only have the S2 and S1 down here. So this is where the S3, S4. So again, not all of the anterior or not all of the spinal nerves are represented in the anterior view. Some of them are only in the posterior view. So we didn't really see the things like the S3 and S4 back here. So it's just showing you like, okay, both the front and the back of the skin and the body has nerves that run to the spinal cord nerves or spinal nerves. So even though it looks like there are clear borders between each of these regions, actually these regions tend to overlap. So it's not like it's a clear defined point, and sometimes they might differ from person to person. Actually, the border between T4 and T5 overlap a bit. And so same with a lot of these other regions. So the thing is that why do they show borders? Well, it would look like a watercolor painting if they actually showed how these regions overlap. So it would be even more confusing than it is now. But again, that's what I want you to know is like, okay, these are generally corresponding to regions that supply feelings of sensation to the corresponding spinal nerves. So I'm going to simplify things for you. So what I'm going to show you is like, okay, here I'm going to show you one of the dermatomes. And here we have one half of the dermatomes. Again, remember, why is there half? Well, remember, their spinal nerves come in pairs. You have it on both the left and right side. So here we have the right side of the patient, and this is the T4 dermatome, the right T4 dermatome. And again, the dermatome, so you have all these nerves here and all the sensations in this area. So all these sensory nerves right here, the ones that do all the sensations of touch, pain, vibration, among other senses, these are going to feed into the T4 spinal nerve. Now, the T4 spinal nerve, remember that there are two halves to the or spinal nerves come in pairs. So this is the right half, and now we're going to have the left half. Now, this is still the T4. It's going to the same thoracic 4 spinal nerve region. Now it's just the left side. So anything that touches this region is going to feed into this root right here and carry sensations to the spinal cord. In this example, we have something touching this T4 dermatome. So this is going to activate sensory receptor neurons. And this is going to carry signals along that T for a spinal nerve on the right side. So what is that going to do? Well, it's going to the spinal cord, and the spinal cord, and we're seeing this cross section here, it's going to relay that signal up to the brain. And then the brain's going to interpret that signal and say, hey, something's touching me over there. So this is how you know where something's touching you. Your brain, these dermatomes, they carry signals to your spinal cord. They go up to a part of your brain that interprets the signal and says, hey, something's touching me there. Now here we have the dermatomes, the open stacks version, and it is a different, showing you a different color pattern, but again, same general principles. Within each of these regions, you have all these nerves that supply sensation signals to that corresponding spinal nerve.